right, and good afternoon, everyone. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Robert J. Havey, MD Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest in the COVID headlines and the news that we've received through the 12th of October. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or directly via email at globalhealthinstitute@northwestern.edu, And leading the discussion today is Sophie Wiskowski, who's a student research assistant with the Institute. So Sophie, I turn it over to you.
Hi, thank you, Kristen. Hi, Dr. Murphy.
Morning.
For some updated COVID statistics, we have 46.7% of the population under the age of 18 fully vaccinated. And over the age of 65, there's 82.9% of the population vaccinated. In Illinois, there's 54.2% fully vaccinated, which is incredibly exciting. And in Illinois, there were 2,500 cases for a 7-day average, which is a 13% decline. So we are under 3,000 officially. In Florida and Texas, there is continuing to be a decline. And in the United States, on October 10th, there were 2,300 cases, which is a 19% decline. Overall, in the United States, there's also a very high vaccination rate, with 47.6% of the population under the age of 18 fully vaccinated. And we have now hit a daily average of under 100,000 cases per day, which is very exciting. What can you tell us about these cases declining as we enter into colder season?
Well, the news is good, as you just outlined. The cases are coming down. We're coming off that fourth wave, and they're declining pretty much everywhere. There are a few states that are still having little blips and outbreaks, as 5 or 6 states, but they're not real big. So this is going in the right direction. And if we look at the patterns in the past, there's this kind of these waves are about 2 months wide. So we're coming down now, just like we came down at the end of May and June of this year, and got really, really low. And then, of course, after July 4th, it spiked up again. So we'll see if there's going to be a 5th wave. I think most likely there will be, because although you pointed out the vaccinated numbers are much better, there's still an awful lot of people that are not vaccinated. Plus the whole thing with the kids, the kids are under 12 are not vaccinated yet. Now that's going to change very soon, maybe sometime in the next week or two, where kids from 5 to 11 will be given the vaccine. It's a much, much lower dose. But anyway, we'll see what happens, see how long it takes those kids to get vaccinated. That doesn't happen overnight. And then the final group will be the 6 months to 4 years group. So that will probably not going to happen until 2022. The good news about the children, the biggest concern most parents had was in the potential risk of myocarditis. That's an inflammation of the heart. And this week, there was really great news, good news for us, not for the study that was done. But the big study that was done up in Canada that reported this 1 in 1,000 rate had completely miscalculated the denominator. In other words, how many people got vaccinated. They knew how many people got myocarditis, but they completely underestimated the total number of people that got vaccinated. It's like 25 times more. So wow. They've withdrawn that paper, and so it is nothing close to 1 in 1,000. It's probably 1 in 25,000 or 100,000, something like that. They have to recalculate everything. So that's good news. So the rate in kids is lower than we thought just a week ago. And remember, myocarditis does just happen. I mean, it's caused by other viruses as well, and so there's a little underneath the current of myocarditis caused by viruses anyway. And so the COVID causes it to go up a little bit, the vaccine goes up, and the disease itself causes it to go up even more. So all that has to be taken into consideration for vaccinating children. So, but this is all, as you said, Sophie, this is, it's really good news overall.
Yeah, it's great. And for some headlines of the week, Biden calls for businesses to in-state vaccine mandates ahead of the federal requirement. What can you tell us about these mandates and what it's going to look like here in the United States?
Well, according to this data here, 1 in 4 companies in the United States have mandated vaccines. These, of course, have been challenged by people that don't want the vaccine, don't want mandates, and they've lost every time in the courts. Biden has, the Biden administration has used OSHA, the Occupational Safe and Healthy Health Authority, to impose mandates on large companies, those with 100 employees or more. That's because the unvaccinated people are putting the other employees at so much higher risk. And that's just not fair to them. And that's really the crux of the whole matter in this whole mandate thing. The unvaccinated are just such a higher risk of getting infected and spreading it to everyone, vaccinated and unvaccinated, that you know, they just basically have to be taken out of circulation until the pandemic is over or get vaccinated. So that's really what that means, and that's where it comes from. And you're going to see more and more mandates. You're not going to be able to travel internationally. More and more companies are deciding about mandates. IBM actually decided, I read a press release in the last 24 hours, they've got a huge workforce. And, you know, it's just going to be dominoes. It's going to be one company after another. And, you know, employees don't want to go to work where it's not safe. The people that have chosen to vaccinate themselves, they're putting themselves at risk. So this is going to continue, these mandates. And, you know, if you want to travel, you want to work in a hospital, you want to work in any of these companies, you're going to have to get vaccinated. So, you know, hopefully you can get the right information to convince yourself if this is right for you or not. Most authorities, of course, would say, yeah, it is the right thing to do.
Right. And boosters here in the United States are complicating a lot of the efforts to persuade the unvaccinated individuals. There's a huge issue right now. The unvaccinated individuals who won't need the booster will not take it. So will you please tell us a little bit about what that's looking like for persuading 40% of this country?
Well, I mean, there are people that think that, oh, you need a booster, that means the vaccine didn't work. No, that's not true. The vaccine worked, but it only worked for a limited period of time. In the case of the Pfizer vaccine, it began to lose efficacy after 4 months. However, that was for more severe disease. That was for people that ended up in the hospital. And it wasn't like 100%, but you started to see a difference from the first 4 months. Still, those people had a much lower death rate. So there's other parts of the immune system that got stimulated that saved them from going in the ICU on a ventilator and dying for the most part. So they still work, but they didn't work as good. Now, boosters in the whole vaccine world are very common. We give boosters for pneumonia vaccine. We give different flu shots every year. Kids get multiple booster shots for their childhood immunizations, and it saves them from getting, you know, these terrible diseases that can cause people to get really sick or even die. So the booster thing should not be construed as, oh, the vaccines are failing. Yeah, they stop working as well, but they continue to offer some protection, and that protection comes back after you get a booster. So there's all the original people, half the country that wanted the vaccine, you know, they're all wanting to get their booster now. And so that is kind of confusing things. And the booster people are like in the pharmacies now, and the rates of vaccines administration is going up. That's all a good thing. But the unvaccinated still have to be careful, because there's so much a higher risk for getting infected, going in the hospital, and even possibly dying from this.
Right. No, right. And with that in mind, CPS is shortening the quarantine time as COVID transmissions in school remain low. What can you tell us about these individuals, as many of them are unvaccinated?
Well, as Dr. Allison Arwadi, the Chief Medical Officer for the City of Chicago stated, they're following the science. And they had a 14-day quarantine at the beginning of the year. They were really afraid that it was maybe too soon to go back in-person school. And although there have been numerous outbreaks, the outbreaks have been small. And then the people that were infected in the outbreaks, because they were watching for them and being very careful and quarantining people for 14 days, the outbreaks didn't cause any like big explosions of infection around their families or in the city, mostly because they did all those mitigations and because so many people in the city of Chicago are vaccinated. So you read the statistics for the state of Illinois, which are looking pretty good, mid 50%. But in Chicago, it's even higher. And DuPage County too, and several of the other counties are doing much better than the state as a whole, because the state is getting dragged down primarily from the southern part of the state and some of the rural areas where the vaccine uptake is much lower.
Right.
And the state is working on that. So anyway, so they didn't have like this big problem in the Chicago public schools that they had expected. And so therefore, they are loosening up to 10 days of quarantine, which is perfectly reasonable because they're seeing such a low rate. So it turns out, I think the statistic was 1.6% of the exposed people in the schools, exposed to some kid or teacher or something that got COVID, only 1.6 got infected themselves. That's a very low percentage. And presuming at least the adults and maybe the older kids were vaccinated, they probably had relatively mild disease and didn't get real sick. Plus, of course, if it's kids, they tend not to get that sick. So the overall problem was not nearly as bad as originally thought. So I think we can say it's safe to go back to school. The opening of the schools in person was good. In-class teaching is, of course, better. It's better for the kids. It's better for everybody. And so now it's safer. We're coming down off that wave, as we talked about at the beginning here. And they can start to loosen things up a little.
Right.
And the next thing they'll be able to do, because they're putting testing in school, is you may be able to get that 10-day down to 7 days. At the university levels, they had looked at the quarantine students, found the same kind of data. Now, of course, college students are adults. They're young adults, but they're adults. And they actually lowered, in many places, the quarantine for the exposed people down to 7 days if they had a test at day 7. So they were using molecular tests, a little bit harder tests than the rapid tests that they have here. But regardless, you can get that quarantine down, and so your whole system is not so disrupted. Because being out for 2 weeks, I mean, that's a half a month. School's only 9 months.
Right.
So everyone that gets quarantined, remember at the beginning of this thing, quarantines were happening all over the place. There was no point to have the school because half the school is always in quarantine. So this is all good news, and the next thing you'll see probably is a drop to 7 days when the numbers continue to go down. If you throw that extra test in at day 7.
Wow, that'll be wonderful if that can happen. So for some viewer questions, husband and wife get COVID April of 2020 and then get vaccinated in April of 2021. They have a 1-year-old child who is obviously unvaccinated. And husband would like to attend a family wedding in Tennessee where the majority of the attendees won't be vaccinated. What are your thoughts and what are your feelings on this and some of the current guideline recommendations that you have for this individual for attending the wedding and should they attend the wedding?
Well, this is a real common issue right now. People having weddings, family get-togethers and whatever. And I've seen like the whole spectrum of what can happen. Tennessee is not a high vaccinated state. A lot of people are unvaccinated and don't want to take the vaccine. This is going to be a very high risk event for this person. My recommendation would be not to go. But if you feel that you have to go, you go, come back. You're going to have, that person is going to have to quarantine themselves from the family. avoid them as much as possible. Wear a mask around them, stay 3 to 6 feet away, get tested after 7 days with a molecular test, and then they can come out of quarantine, or 10 days with, I think, any kind of test. So it's going to be a little cumbersome, but that would be the safest thing to do. On the other hand, I know some weddings that have taken place on the East Coast in states with much higher vaccination rates, where the event required everyone to be vaccinated. The people coming in to cater the event and stuff had to be vaccinated. Everybody had to have a test before they went. And then in one case, they even had the rapid test while they were at this weekend gathering. And nobody got infected. So it can be done safely. The times are looking good and everything. Why get COVID now? Every day, we just learn how horrible COVID disease itself is. We talked about the myocarditis in kids. They get myocarditis, when they get COVID, they get myocarditis, like 5 times or more the rate. COVID is bad. Long COVID, symptoms that persist 6 months or more, is common. It's 15 to 30% of the people that get infected. All sorts of things happen with COVID. Pregnant women, it's been found out. This has been followed now since the beginning. Pregnant women who get COVID really have much more problems than we originally thought from the COVID itself. So much so that last month, the Centers for Disease Control changed their guidance to strongly recommend that women at any stage of pregnancy or postpartum after they deliver should be vaccinated. That there's no safety issues that have come up after, almost 400 million doses of vaccine have been given in this country. I mean, my goodness, and in the world, it's like, I think 3 or 4 billion right now. They know about the safety profile about this vaccine. Billions of doses have been given. So, and it looks like there's no issue in pregnancy or in the fetus or the baby, the newborn baby. So, it's just time to do it. And, that's the way it's going to go. So in this case, I would think, if you're going to do it, you got to come back in quarantine. And the best thing would be not to go this time around until the pandemic is over.
Right. No, that makes sense. And this individual is a 66-year-old fully vaccinated woman in the Chicago suburbs who lives with someone who's immunocompromised. When do you think it'll be safe for her to return to the gym?
Yeah, well, it's great that she's working out at the gym. I think it's good for everyone, especially elderly. Physical activity is very important in the elderly and everybody, but I mean, you're not supposed to stop physical activity as you get older. That's very bad for you. So that's really good and encouraging. However, the immunocompromised person at home is very concerning. So some of the health clubs mandate that everybody working there and going there is vaccinated. So that's step one. That's got to be, she has to find out if that is the case. If they don't answer yes, don't go there. Sorry, you're gonna have to work out at home. But if everybody is vaccinated there, and when people are socializing there, they wear a mask, it should be fine. But it's loosening up in that particular category. The same is true about theaters and movies and live theater and movie theaters. Getting people together more, and it can be done, but you've got to have you got to get everything in place. And as you can see with these mandates, one of the mandates is going to be showing proof that you're vaccinated to go to someplace. In New York, it's going to be indoor dining. In many countries in Europe, you can't go indoors anywhere publicly unless you have a vaccine. So it's very, very disrupted on the social life. if you're unvaccinated or you refuse to be vaccinated, or you don't have a vaccine, international vaccine card, or they accept the CDC card that we get here. So yeah, so that really kind of is the issue. Hanging around with vaccinated people is just a lot safer.
Right. And speaking of vaccinations and boosters, this person is not eligible to get the Pfizer booster, being that they are 62 years old. Does this mean eventually that they will have to go through the 2-shot process as their immunity weakens?
Well, this question brings up two very important points. One is, I think there's no reason why this person should not have a booster. This person should have a booster. I completely disagree with these advisory committees that have limited to 65 and above. The immunity wanes at 4 months. There's no big age drop off. So older people are at higher risk. Okay, yeah, but who wants COVID? Nobody should want COVID. So, but we got to live with what we have. When they finally, the pandemic is still going in 3 years, she'll be eligible. Now, but I would think that the guidelines will change again. The EUA for the booster shot will change again at some point for everybody who's been vaccinated. And I think you're going to see more of this. They're reviewing the Moderna data this month and the Johnson & Johnson data, which also looks very positive for booster shots, the Moderna with a lower dose. Pfizer they'll get more and more information about the risk. And when that data becomes available and convince these people on these committees that, nobody wants to get COVID, they will lower the age. So, stay tuned. This is a very dynamic process.
Yeah. And lastly, is it true that people that get rapid COVID tests with just the nasal specimen can and most likely will test negative if they're actually positive? If so, why are they being offered throughout Chicagoland if they're giving out so many false positives?
Yeah.
Negatives, I apologize.
Yeah, okay. Yeah, no, this is a problem. They are not 100%. Nothing, first of all, nothing is 100%. All right, so what do we accept? With the molecular test, if you want to spend over $100 and wait a couple days to get your results, you're going to get 99.5% with the PCR test, but it takes so long to get the results, you kind of like the whole game sort of is over. So with the rapid tests are very good if the percentage is higher if the person is symptomatic or just about to become symptomatic. So they've shown that doing 2 of these tests, at least 36 to 48 hours apart, is actually as good as doing 1 of the PCR tests. That's roughly, okay. So that's why in some of the home tests, you get a 2-pack, and it tells you right on there, do 1 today, and then 36 hours or more later, do the other one. And that would be as good as the better test. So 85% positive, or 80%, even 80%, is certainly better than nothing. And it does identify the really contagious people because it's associated more with the process later in the disease. So so the tests are good. They're not perfect. And if you take 2 of them, it's better than 1. And the nice thing about it is you can just go to the pharmacy, supposedly, and buy these things. Now, they've been flying off the shelf. So, you may have to look around a little bit, but, that problem is also being solved. The administration has just purchased, I think, over 100 million kits, and, they're distributing them, subsidizing them everywhere. In Europe, they subsidize them. And so they have little testing kiosks kind of all over the place, and people can just walk in and just get tested. No question asked. I was driving to Michigan a couple of weeks ago, and they had at a rest stop on an interstate highway, they had free COVID testing. So I was very impressed that get free COVID testing at a rest stop on a highway. But that's the kind of stuff that has to really be done.
Right. No, absolutely. Well, thank you, Dr. Murphy. That's all for today.
Great. Thank you.